Hi folks, this is John Adamson, the Rehab Documentation Guru, and today we're going to be looking at a speech therapy piece of documentation. Hang in there if you're a PT and or OT because you'll still get something out of this, but I often am charged by my speech therapist friends with neglecting them a little bit, and so this one's for you. We actually have two slides we're going to go over. First of all, we're going to look at treatment that's multifaceted. So this speech therapist for treatment codes put 3. And one of the things that a reviewer of a claim will do is look at whether or not all those treatment codes are necessary and if they're all supported. The other thing that they'll look at is they'll compare them to the diagnostic codes that you've utilized to see if this is a viable treatment code for the diagnostic code used. So first of all, let's look at 92507, treatment of speech, language, and voice, probably the #1 code that's used by speech therapists. Then we have 92526, treatment of swallowing dysfunction and or oral function for feeding. And then lastly, we have G0515, which many of you recognize as being a code that came into effect January 1st of 2018, cognitive skills development. This replaced 97532. And cognitive skills development, just for your information, is a code that should be used only with patients that have new lesions or subacute lesions. So a traumatic brain injury, a CVA, that type of thing. Generally, this is not a code that would be utilized for a chronic progressive cognitive dysfunction like Alzheimer's. So I just let you know that this patient did not have an Alzheimer's diagnosis or another chronic progressive type of dementia. So that may be an appropriate code, but we're going to see if all these codes were supported. Now, the treatment diagnoses for this patient were dysphagia oral pharyngeal phase. That's good because that's specific, and we talk about in my course documentation bootcamp on making sure diagnoses are specific. And then we also have R41.841, which is cognitive communication deficit. Now, what's interesting about this code is that you'll notice there's 2 words there, cognitive and communication. And it generally would sufficiently cover the treatment of 92507. We don't necessarily need to use G0515 in this case. And when you look at these codes, the treatment codes, and then you look at the diagnostic codes, there are no other codes that would support 92507 or G0515. So the therapist has to ask themselves, do I really need to treat both 92507 G0515? And in this case, it would appear not. And we'll see in the skilled documentation that appears to be the case. Now let's look at this one. We've got dysarthria and enarthria. And I'm not a speech therapist by any means, but I use my handy dandy friend, icd10data.com, and also Google, just to make sure that I knew what I was talking about. And this has to do with difficulty articulating words and also remembering words to be able to say them. And please, speech therapists, no hate mail if I got that slightly wrong. But anyway, those are the things we're going to be looking at in the skilled documentation on the next slide. So now we're looking at the skilled documentation, and what I've given you is the first 2 bullets are actually back-to-back skilled statements. They're 1 progress note, and then 10 treatment days later, the next progress note. And we're going to compare them. So the first one says speech therapist instructed patient to complete various oral motor exercises in order to improve swallow strength / safety during meals. Prompted patient to complete various short-term memory exercises. Facilitated patient in repeating and reading sentence length material utilizing clear speech strategies and probed prosodic elements of speech. Now I'm going to stop there, and I'm going to go down to the 3rd bullet where it talks about skill. And this is the formula that I teach in my course on how to document skilled statements. First of all, we look for whether the intervention or CPT code was mentioned, and it was not. As stated, suppose all three of those billing codes we saw on the previous page were all billed. You as a therapist, especially if you're a speech therapist, you would be able to say, well, I can see where each CPT aligns very easily. But we have to remember that the reviewers of our claims are not speech therapists. They might have some speech therapists working for Humana, Aetna, Blue Cross Blue Shield, Medicare. There might be some out there, but it's very few and far between. So this is likely a nurse. And to help them better align what was billed and why, and make sure they can see the skill behind that code, we should tell them the CPT code. So that's missing. The next thing we look for is action words, and we do have several. We've got instructed in the first sentence, prompted in the second sentence, facilitated in the next sentence. So those are good action words. Now let's look at target of the action. Okay, so the speech therapist wanted the patient to complete oral motor exercises to improve swallow strength, safety during meals. Now that's fine. One of the things that I would look for then in the documentation is, do we have objective measurements to support that swallowing strength and safety was an issue, to make sure that this treatment is correlated with objective measurements, and that's important. Okay, the next one, prompted patient, I'm sorry, let's continue with special techniques. Now, let me see, what did they do? Completed various oral motor exercises. Well, it's not really a statement of a special technique, so I have no idea what this speech therapist did. There are different oral motor exercises. They do different things. There's lots of oral musculature, and so what was targeted? And that's another missing thing, is the whole target is missing, but also we don't see any special techniques. So the swallow function statement so far does not look very strong. Prompted patient to complete various short-term memory exercises. Okay, what were those exercises? Could the patient be have been given very simple short-term memory exercises that a non-therapist could administer to them? So we don't know what the skill was behind that. Facilitated patient repeating and reading sentence length material utilizing clear speech patterns, and probed prosodic elements of speech. Now that sounds pretty good, and I forgot to look up what prosodic means. I'm going to guess that's pretty skilled element. However, the first part of that sentence sounds like somebody could have been trained to do this thing with the patient that's not a therapist. And so I'm going to question going forward, is this truly a skill? We're not really seeing much in the way of special techniques. Now you'll note there's two other things under skill. Patient response. Now don't worry about that so much in this particular review, because that'll probably be evident in the measurements related to how the patient's progressing on their goals. But what should be evident in skilled statements from one note to the next is what we would call evolution over time. Is there adjustments? Is there modifications being made? And you'll note that I have highlighted or bolded various sentences in both these statements. Keep in mind the second bullet is 2 weeks later. First sentence, exactly the same. The second sentence, well, that's new, pharyngeal strengthening. So we see evolution of care in the area of pharyngeal swallow, or the swallow billing. But then the next two sentences are exactly the same, except for the very last portion of that last sentence on the first one. The prosodic elements of speech is not there. So, is there evolution of care over time? And the answer is no, there's not. So these elements need to be present to support the skill, and we see a lot of opportunity in these notes. We also see perhaps that it's clear that both 92507 and G0515 did not have to be billed, because basically everything here appears to be speech treatment related, not cognitive. and therefore the G0515 code is not supported at all. The other two, 92507 and 92526, are supported somewhat. They could be strengthened, but it's not bad. Anyway, I hope you found this helpful. If you have any suggestions for future videos, please let me know. And as always, hit the like and subscribe if you're not a subscriber, and tell your friends. Because the more people that know about this channel, the more people I'll be able to help. And also, it'll help eventually me hopefully generate a little bit of income off this YouTube channel for the time I put into it. Anyway, that's it. I'll talk to you all later.